So Mark, let's talk about making our care more consumer-facing rather than thinking of our patients just as patients, but more as consumers who decide they want to come to Intermountain and have us give us the privilege of taking care of them.
The current state where we have rooms that we call waiting rooms, we know that no one really likes to wait for things, and especially today, as a generation, the rising generation of consumers is much more technology focused. They're going to want to use a tablet or a smartphone or a video link to connect with us. But I think even more importantly than how we connect from a technical perspective is we need to have the ability to engage consumers in staying healthy. So gentle reminders that come from us, from your physician, to the patient that just checks in and says, hey, I see you haven't been as physically active as before. Or an annual checklist of things that we will ask each patient to do. So you need your flu shot, and you need your cancer screening, and it looks like your kids are overdue for their vaccinations for school. You know, in the past, we've waited for moms and dads to remember, oh, I've got to get my vaccines done. And we shouldn't be doing that. We should be reaching out and saying, look, your son or your daughter is due for a checkup. We want to check their growth and development. They'll need some vaccines. And we begin to share in that responsibility of staying healthy and preventing conditions that we need to.
Right. So we're at HIMSS 2015, and patient engagement has been a big concept. And there was a comment made earlier about how waiting rooms are going to be a thing of the past.
Yeah.
What's going to be our strategy at Intermountain as we implement iCentra to think differently about the waiting periods that are inherent when you have care moving from one stage to the other?
One of the things we need to do right away is make sure that we're fully leveraging the portal, the patient portal. So it's not just the patients coming to us, but also us going to them and offering them the type of visits that are going to be more convenient for them. So like a telehealth visit, or even a visit where they have seasonal allergies. They know that they have seasonal allergies. They know they're due for a new prescription to treat it, and they can access their physician through the portal, answer a few questions. We make sure that yes, it's seasonal allergies. Get the prescription out to them, and they didn't even have to leave their place of work or find a sitter for the kids or drag them to the office with them to get that taken care of. And I think when you add that type of value to the population that you're serving, and you are focused on their needs, that's what is going to engage patients and help make them want to be part of the team here at Intermountain Healthcare. Be engaged with their primary care physician and our group of specialists, and it's technology coming together, helping people stay healthy.